Welcome to today's Pap Chat. I'm Susan Dinter, and today we are honored to have Dr. Stephen Nimer, Director of the Sylvester Comprehensive Cancer Center, as our guest. Joining me is Beverly Berkowitz, Officer at Large on the Board of Directors. So welcome. Dr. Nimer, we are thrilled you could join us today to talk about one of PAP's most important initiatives, the Dr. Kevin Berkowitz End of Year campaign, which, by the way, folks, is not over until February 28th. The proceeds from this campaign are supporting new clinical trials at Sylvester. So, Dr. Nimer, can you tell us about these trials and their status?
Sure. Thank you very much, Susan and Beverly, and thank you, everyone in the Pap Corps for your tremendous support of our mission for decades and decades. The Cancer Center is doing very well since we've become NCI designated. We continue to open new clinical trials and to attract new clinical researchers. One of the areas that we have focused on has been what are called GU cancers, or genitourinary cancers. Those include things like prostate cancer, bladder cancer, kidney cancer, and testicular cancer. As you know, that we opened up our proton facility in September, and so we now have some proton therapy trials for patients with GU cancer. We've also been working on new robotic surgical approaches to these cancers. And we have, for prostate cancer in particular, a number of trials to try to identify which men can have watch and wait when diagnosed with what seems like a non-aggressive prostate cancer. But there are some men where the prostate cancer looks like it's low grade, but it actually behaves much more aggressively. And these are men who need surgery or radiation treatments. And so we've been investing quite a bit in terms of analyzing prostate cancers so we can figure out who truly needs an intervention and who does not. I would say also with our Proton Therapy Center, we are beginning to do clinical trials where we evaluate the use of proton therapy for prostate cancer. Another area for prostate cancer has been what's called HIFU, and we're one of the leaders in the United States using high-frequency ultrasound. And that approach is a non-surgical approach and can be used to treat enlarged prostates, but also we have one of the largest experiences in treating prostate cancer. And so there are more and more options for men with prostate cancer. It's an area of focus. The other areas in GU include kidney cancer, where Dr. Dipin Parekh has been one of the leaders in kidney sparing surgery. At many places, if you have a kidney cancer, they remove the entire kidney. And his research has been involved in understanding how to leave the remaining kidney so you preserve some kidney function. And so that's an area that's very important for us and for future growth. Another area has been breast cancer. We have hired 4 female breast cancer surgeons within a by the last year and a half. And they're getting grants, they're getting protocols. We have some very interesting studies going on looking at women from underrepresented minorities and trying to identify whether the risk factors for a poor outcome are the same in women of color, for instance, and also given the different genetics of breast cancer to try to identify how to pick specific treatments for specific women. We have a lot going on for women with metastatic breast cancer also. And that work is also supported by the Pap Corps. One of the interesting things is there's a big difference between premenopausal breast cancer and postmenopausal breast cancer. And we're doing a lot to understand how the change in hormones when women undergo menopause may affect the growth of breast cancer cells. Another area of focus has been in brain cancer. And in brain tumors, we have initiated a number of very interesting trials using targeted treatments to try to identify the specific mutations in the cancer and then focus on overcoming the processes that those mutations initiate. And so Dr. Macarena de la Fuente, Dr. Rick Komitar are all working together to advance our treatment of the most common and the most serious form of brain tumors called glioblastoma multiforme, or GBM. And we have other workers, Dr. Nagia Yad and others, that are developing new treatments for brain tumors. And those three areas have been the focus of the end of the year campaign, tackling the most serious cancers and also cancers that primarily affect men or women.
Dr. Nimer, having Sylvester in Deerfield Beach allows so many of our members, friends, and family to participate in trials and to receive cutting-edge medical treatment. Can you tell us how the Pap Corps funding propels Sylvester's ability to serve our community?
Yes. So you've mentioned, of course, the Deerfield Beach facility, and we have the Plantation facility. We now have one in Aventura. We're opening up one next month in Fort Lauderdale. And so it's very important. You know, we've been attracting the best and the brightest, and we want to be able to deliver the care in a locally and regionally convenient manner so people don't have to travel far to get the best treatment. Now, the Pap Corps has, by virtue of the funding that we've had, such consistent support, really enabled us to recruit a lot of really top people. And for instance, right now, the group that's going to be primarily in Fort Lauderdale is also in Deerfield Beach seeing patients. Our survivorship programs have been supported by the Pap Corps, and they're in Deerfield Beach. And I think the other thing which we talked about quite a bit at the end of this last year has been the Game Changer vehicle, which we are going to be rolling out hopefully towards the end of this year or during this year, which again allows us to project our expertise and deliver education and research and hope to people that are living in the proximity of Deerfield Beach, northern Broward and southern Palm Beach counties.
So Dr. Nimer, has the NCI designation, and I would probably think that it would, helped with getting more clinical trials?
So we are now a part of the NCTN, the National Cancer Clinical Trials Network. And so that's allowed us to open up a lot of trials. We just received a grant from the federal government. It's called a catch-up grant, not KETCHUP, but CATCHUP. And that's a grant where we work with community partners. And in addition to the NCI grant that we get by virtue of our 2019 application, this is about $750,000 to make sure we can impact minority communities, breast cancer, ovarian cancer, cervical cancer. And so the word catch up implies that there are communities that have been underserved, and these are funds specifically to work with community partners to help. And so all of these things are enabled by the NCI grant. This catch-up funding is you can only apply if you're an NCI designated cancer center. And I would point out that it's very competitive. So I think that they gave 3 or 4 of these grants out, and they probably got 20 applications. And so we are continuing to take every advantage of the NCI dollars. We have many more patients coming in, I think in part due to NCI. We're attracting more philanthropy because of NCI. And we're also developing some international partners because of the NCI designation. So the impact is huge. And Susan, I can tell you that we mentioned Dr. Ola Landgren as one of the people that we've recruited. And I think NCI designation was critical for that. He is probably right now doing the best work in the world in multiple myeloma. And you haven't heard me say something like that before. I usually like to say top 5, top 10 in the United States. But his programs and what he's doing in this field and what he's going to be able to do for people in South Florida is going to be transformative. And so many of the other recruits. We have a new GU cancer recruit who's coming from the National Cancer Institute, and he doesn't want us to use his name until May. So it's a secret. We'll have to wait till the next chat. But these are really the best in the country. And it's because of the NCI and the support they see from the community.
Dr. Nimer, we know that you've been quoted as saying it's all about clinical trials. Can you explain why you really feel that way?
Sure. There is almost no cancer where we have achieved everything we want to. Now, there are some cancers where it's more difficult to make progress. So let's say you are already curing 95% of the people. If you have a new treatment, you have to really treat a lot of people in order to show that yours is better than the 95th percentile, because let's say your treatment works 97% of the time, you may need thousands and thousands and thousands of patients to show that. That's not where we are for most cancers. We're not curing 95% of the people. And so for almost every cancer, we cannot just rest on our laurels and say, well, we've got a third of people living 5 years, or 10, or we have 60% of people living 5 years. That's not good enough. And the only way that we're going to make progress is by doing research. Does drug A work better than what we're currently doing, or is what we're doing better? So we have ideas all the time. These trials are being done all over the country. But what's happened is, in the past, we were blindly picking drugs. Now we know so much about cancer, we know so much about these drugs, that when we test these drugs in people, they work. And our job is to find out what's the best dose, how often should they be given. But it's no longer really, is the drug going to work? The question is, how well is the drug going to work? And is it going to replace what we're currently doing or not? And so for people who have run out of options, in particular, these drugs can be life-saving, right? They work, and they're only available at certain cancer centers. And so we have a huge obligation to make sure we have all these drugs at Sylvester so that our patients can go to see, the doctors in their community at Sylvester, and we can take care of people.
Our end of year campaign is one of the most important to all of us at the Pap Corps. And it was launched by Beverly's son, Dr. Kevin Berkowitz, which the board of directors voted a few years ago to name the campaign after. So Beverly, can you share why Kevin launched this program?
Yes, my son Kevin was devoted to innovative research and understood the future depends upon developing cutting-edge treatments. When he was presented with the idea of the end of the year, he immediately volunteered to support matching funds. And since then, which was, he was approached in 2014, this campaign has funded stem cell research, pancreatic research, pediatric research, melanoma, and our amazing game-changing vehicle. And of course, this year, we're dedicated to clinical trials. We have raised over $1 million in research funds for Sylvester. You're welcome. Thank you. And so I am certainly proud that this fund carries my son's name, but it carries more than that. It carries your generosity. And we are asking this year, please participate in giving to the end of year campaign. We depend upon it to be able to give a generous gift to Sylvester to support research. Thank you.
Thanks, Beverly. You know, we have many ways to support the Dr. Kevin Berkowitz end of the year campaign, which runs, by the way, until February 28th. You may donate directly to the end of the year campaign on our webpage, or participate in a raffle and wine event that is titled Support the Next Survivor. Just go to our webpage, www.thepapcorps.org, and find out how many ways there are to give. So Dr. Nimer, once again, thank you so much for joining us today. We were just thrilled when you agreed to do this. I always find your talks so inspirational. So do you have any parting words for our members?
You know, a thought came into mind. You know, because of COVID, and excuse the bold pitch here, but because of COVID, you know, I haven't bought any new clothes, and I haven't spent any money on hotels, nor on, I haven't bought an air ticket in a year. And so what would be the better way to celebrate the promise of science, the promise of the vaccine, the promise of us getting back to life again, but to fund cancer research at Sylvester? So those are, that's a message for everyone. You know, the support is fantastic. I've said it before, I'll say it again. I look forward to having some rugelach with everybody, you know, and coming back up to Boca or wherever you're going to meet next and getting back to a normal life. But also for cancer patients, COVID, not COVID, they've got their hands full. And we're doing everything we can. We have hundreds of dedicated physicians and researchers working literally day and night to find better treatments and to help prevent cancer. So thank you so much to everyone involved in the Pap Corps.
Thank you. So do what Dr. Nimer says, support the next survivor by giving to Dr. Kevin Berkowitz end of the year campaign. It's so easy. You just go to our webpage. So thank you for joining us. Just stay safe.